Welcome back to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about perinatal hepatitis B, otherwise known as hepatitis B in infants. And our special guest is Lori Schiffauer, a community nurse with the Frederick County Health Department. Lori, welcome, and thank you for joining us.
Thank you for having me.
Well, let's start with what is hepatitis B?
So hepatitis B is an infection, it's a liver disease that's caused by a virus. And for some individuals, that virus can be cleared very easily. For other individuals, it can cause long-term disease effects, long-term liver cancers, liver cirrhosis, those kind of things.
Okay, well then how common is hepatitis B?
Well, it's estimated about 350 million people in the world have hepatitis B. In the United States, it's about 1.2 million people. But in Frederick County in 2011, we had 36 new cases diagnosed within the year.
Well, how do people know they have hepatitis B?
The best way to know is to be tested. It's a simple blood test that you can get from your physician. Like I said, some folks will have symptoms of hepatitis. They can have nausea and vomiting, diarrhea, even yellowing of the skin in their eyes. But there are folks who do not have symptoms, so it is important to be tested.
Well, and then how do people become infected with hepatitis B, since it sounds like they might not even know that they become infected?
So it's spread by blood or specific body fluids. So if there's an exposure to blood, the first things we think of are folks that have unprotected sex, folks that are injection drug users that may share their needles or works, but even household members of an individual with hepatitis B could be exposed through the use of personal items that they have, sharing of razors or of clippers or of toothbrushes, those kind of things, or even a glucose monitor.
Well, I guess then that leads to the next question that I have, which is how can hepatitis B infection be prevented in the first place?
Well, there is a very good hepatitis B vaccination. It's been in place we've been using it for about 30 years. First was focused on those high-risk groups, but now we're up to vaccinating infants during their early infancy.
So, yeah, let's talk a little bit then about the infants. How do the infants become infected?
They can be infected from mom. During the delivery process, there is some exchange of body fluids, so the baby can be infected that way. And in fact, if it's untreated, in about 90% of the cases, the baby will become infected. So it's a great opportunity for us to offer prevention treatment for that infant to try to prevent that infection.
Well, maybe you've sort of touched on that, but maybe there's something else that you would want to add if I ask, so why are we concerned about the infection?
Number one, because it's so easily transmitted, but also because it's so easily prevented. So it just takes a series of 2 shots that the baby would receive right after delivery. One initially boosts the baby's immune system, and the second one is actually the beginning of that hepatitis B series so that the baby can begin to develop its own immunity.
What are some other steps that can be taken to prevent the spread of hepatitis B?
Anytime when you're sharing blood and the potential for sharing of blood, so within the households we need to think about sharing of those personal items, and also vaccination is very important for that. And
so for infants that are being followed because their mother was infected with hepatitis B, are there things that additional tests or vaccination for the infants after they leave the hospital? Because you mentioned at the hospital.
Yes. Once they leave the hospital, they'll need to complete that 3-dose series. So they'll get their second vaccination at 1 to 2 months, and then the third vaccination at 6 months of age.
Okay. And then for other prevention measures, are there other folks in the household that you would also recommend that they do something if the case where the mother in the household was found to have hepatitis B?
Yes, if we know that she has hepatitis B, then any household members should be screened and be tested. If they are negative, then they should be vaccinated to develop their own immunity and protection. And if they are positive, then they should be following up with a healthcare provider also to follow up in their disease.
Okay. And then what role does the health department's perinatal hepatitis B program play in assisting healthcare providers and their patients?
Okay, so hepatitis B is a reportable illness, so it gets reported to the health department, but what we primarily focus on is educating mothers. They, for some, have had no symptoms, have no idea until they've been tested that they actually are infected. So what we want to do is provide them with education so that they can protect themselves, follow up for care for themselves, and also to protect their families. We also do education of the household members and offer screening and testing for those household members so that they can get vaccinated if it's appropriate.
Okay, well that's great. You've provided some really good information for folks about something that they may not have heard much about, but especially for women in childbearing age and who are thinking about becoming pregnant. It's important for them to know their status because they might not know they're infected. Is that right?
Exactly, exactly.
Very good.
Thank you.
All right, well thank you for joining us.
Thank you.
And now please stay tuned for this month's Medical Myth.
If you're 55 or older and looking for a way to get moving and strengthen your body, then join the Frederick Senior Center for its strength training class. This class is offered daily and no pre-registration is required. For just $2 a class, you can develop strength, flexibility, balance, and coordination. Strength training also increases your metabolism, which can help control weight gain and help lower your blood pressure. So stop thinking about it and start exercising today. Classes are offered at the Frederick Senior Center, located at 1440 Taney Avenue in Frederick. For more information and class schedules, call 301-600-1605.
Are you looking for that perfect spot for your child's next birthday party? Look no farther. Frederick County Parks and Recreation can fulfill all your birthday party needs. Choose from any of our rec center locations. Your party rental includes tables, chairs, paper products, on-site facility supervisor, and much more. Pricing for our parties is $120 for 2 hours in our rec room or $170 for 2 hours in our rec room and gymnasium. For more information and availability, call 301-600-2936 or visit us on the web at www.recreator.com.
And now here's this month's Medical Myths. This month's Medical Myths is about influenza or flu vaccines. A commonly repeated myth is that you can get the flu from the vaccination. Well, that is a myth. The injectable flu vaccine does not contain the live virus, so it is impossible to get influenza from the injectable vaccine. Side effects may occur in some people, such as mild soreness, redness, or swelling at the injection site, headache, or a low-grade fever. The nasal spray vaccine contains live, attenuated, which means weakened, viruses that can cause mild signs or symptoms, such as runny nose, fever, sore throat, and nasal congestion. This vaccine, however, cannot cause influenza infection in the lower respiratory tract, or say in the lungs. Another common myth is that people believe that if they start to show signs and symptoms of influenza, that they can't spread the flu if they just decide to stay home at that point. Well, the truth is that people start to shed and spread the flu up to 2 days before they even feel symptoms. So using the appearance of symptoms as a guide to needing to avoid others will only result in more spreading of influenza. I have also heard people say that the flu vaccine doesn't work. Well, the influenza vaccine will prevent influenza most of the time. In scientific studies, the effectiveness of the vaccine ranges from 70 to 90%, depending upon how well the circulating viruses that season match those in the vaccine. In populations in which the vaccine is less effective in preventing influenza, such as older folks, the vaccine reduces the severity of disease and the incidence of complications by influenza by 50 to 60%, and the incidence of death by approximately 80%. Finally, a common myth that I hear is that the flu isn't a serious disease. Well, influenza or the flu is a serious disease of the nose, throat, and lungs, and it can lead to pneumonia. Each year, about 200,000 people in the United States are hospitalized, and about 36,000 people die because of the flu. Most who die are 65 years or older, but small children less than 2 years old are as likely as those over 65 to have to go to the hospital because of the flu. In Frederick County, flu is in the top 10 leading causes of death in some years, so it is significant to us in Frederick County. Getting vaccinated is the most effective way to protect against influenza and its serious outcomes. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Communicable Disease and Preparedness Program of the Community Health Services Division. It's flu season, and it's important to protect yourself from getting the flu. Annually, more than 200,000 people are hospitalized and 36,000 people die from flu-related complications. Influenza can affect anyone, babies, young children, adolescents, adults, and seniors. The CDC recommends a yearly flu vaccine as the first and most important step in protecting against flu viruses. You need to get a flu vaccine each year as the strain of flu viruses in the vaccine can change from year to year. Everyone 6 months of age and older should receive a flu vaccine. Babies less than 6 months of age cannot receive a flu vaccine, so it's important that everyone who can receive a vaccine get vaccinated so that you can help protect those who cannot get the vaccine. There are two types of vaccine: the flu shot given by an intramuscular injection in the upper arm and the intranasal vaccine, flu mist. Healthy individuals 2 to 49 years of age who are not pregnant can receive flu mist. The flu shot is available for everyone 6 months of age and older, regardless of their health status. If you have not already received your flu vaccine, contact your healthcare provider as soon as possible. Flu vaccine is also available in the community at places like drug and grocery stores. In addition to getting your flu vaccine, the following actions can decrease your chance of contracting the flu. Wash your hands frequently with soap and water. Cover your nose and mouth with your sleeve when you cough or sneeze. Throw tissues in the trash after you use them, and remember to wash your hands. Avoid touching your eyes, nose, and mouth since germs are spread this way. Try to avoid close contact with sick people. If you are sick with flu-like illnesses, fever, headache, general aches and pains, weaknesses, stuffy nose, sore throat, or cough, and possibly vomiting and diarrhea, avoid being around others. You should stay home for at least 24 hours after your fever is gone without taking medication to reduce your fever, except to get medical care or for other necessities. The Frederick County Health Department has free flu vaccine available for children 6 months to 17 years of age. Both the flu shot and flu mist are available. An appointment is required. For more information about the flu or to schedule an appointment, please call 301-600-3035 or visit our website. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.